Assalamualaikum warahmatullahi wabarakatuh. Hello Miss, how are you? I hope you are always in good health and happy. I will introduce myself. My name is Febriani Sucipradi from Class A Nursing Major. In this video, I will present my final project briefly from the first material to the last material. Starts from the first material is admitting patient. Admitting patient is a method or process of accepting the arrival of new patient to be served, cared for in a health care unit. The second material are the same about patient. After I watched the video on YouTube with the shared link, I concluded that the preparation stage admitted patients are the bed is clean and ready to use. And the second, willing facilities are in good condition. The third, the patient table and chairs are clean. Fourth, care or souvenir package. 5. The new patient and family orientation sheets. And the 6. Medical record files. 7. Internal inspection equipment containing a thermometer, tensimeter, BB, scale if necessary. All about postoperative care. Postoperative care is a routine procedure performed immediately after surgical operation and will usually be carried out until the patient has fully recovered. For the same about postoperative care, after I watched the video on YouTube, I concluded that there were 3 stages in pre-operative period, namely the surgical process starting pre-surgery, intraoperation, and post-surgery. Caring terminally ill patient. What is caring terminally ill patient? Caring terminally ill patient is for people who are nearing the end of life. The services are provided by a team of healthcare professionals who maximize comfort for a person who is terminally ill by reducing pain and addressing physical, physiological, social, and spiritual needs. Okay, the next material, the same about caring of terminally ill patient, concept of loss, grieving process. Loss is a necessary part of life and grief is a natural part of the healing process. Types of loss, 5 categories of loss. The first is loss of external object, and 2, loss of a known environment, and 3, loss significant others, and 4, loss of an aspect of life, and the last, loss of life. 5 stages in grieving. First, namely Daniel, anger, bargaining, depression, and acceptance. The district nurse. District nurse is a nurse who goes to people's houses to give them medical treatment and advice. And the same material about district nurse. District nurses are just one of the types of nurses who work in the community rather than in a hospital as a district nurse. You may work in many different locations around the community, but your time will be spent mainly in people's own home. Okay, the next material about helping patient with rehabilitation. Helping patient with rehabilitation is an essential part of universal health coverage along with promotion of good health, prevention of disease, treatment, and palliative care. Helping patient with rehabilitation. After I watched a video on YouTube about post-stroke rehabilitation or CVA, I conclude from the video that rehabilitation helps someone who has had a stroke relearn skill that suddenly disappear when part of the brain is damaged. The goal of rehabilitation is to improve or restore your speech, cognitive, motoric, or sensory skills so that you can be as independent as possible. Stabilizing patients. After I watched the video on YouTube, so in that scenario, the nurse helps the patient recovery after spinal surgery by mobilizing the patient using a toilet seat or wheelchair. I concluded that manual patient handling or mobilization means the lifting, transferring, repositioning, or mobilizing of part or all of a patient's body done without the assistance of equipment. Medical imaging is the technique and process of imaging the interior of a body for clinical analysis and medical intervention, as well as visual representation of the function of some organ. Helping patients with diabetes management. Diabetes is a disease that occurs when your blood blood glucose, also called blood sugar, is too high. The main goal of diabetes management and control is, as far as possible, to restore carbohydrate metabolism to a normal state. To achieve that goal, individuals with an absolute deficiency of insulin require insulin replacement therapy, which is given through injection or an insulin pump. Material about managing diabetes. You can manage your diabetes and live a long healthy life by taking care of yourself each day. Diabetes can affect almost every part of your body. Therefore, you will need to manage your blood glucose levels, also called blood sugar. Managing your blood glucose as well as your blood pressure and cholesterol can help prevent the health problems that can occur when you have diabetes. Okay, I think that's enough about my presentation. Thank you for watching. Wassalamualaikum warahmatullahi wabarakatuh.